this?
Forever. It's been 7 years.
Room 3, Cooper.
Okay. Hello, how are you? Oh, Michael, nice to meet you. Michael, nice to meet you. What do you think, big dog?
Hi.
What do you think, bud? So Cooper's 13 years old.
Almost 14.
Oh my goodness. 13 or 14.
Go over there. Go over there.
Hey, dude. And just kind of towards the end of last week, you started noticing the atrophy on the left side of the head.
I work in Chicago, so when I came back this time, I came back on Sunday, and I looked within 10 minutes, he came and faced me straight on, and I go, oop,
Okay.
you've got a sunken head.
Okay. And no acting uncomfortable,
Nope.
eating fine,
Eating fine.
personalities.
He does chew his rawhides or whatever he's chewing more with his right side now than with his left eye,
Okay.
now that I'm aware of it.
Okay. I know all these people are getting up in your business and stuff. All right, Mr. Nervous. You can relax.
Good job, buddy.
So there are the muscles of chewing, or what we call muscles of mastication, are innervated by a nerve called the trigeminal nerve. And the most common reason that we see for unilateral atrophy of the muscles of chewing on one side of the face is a problem affecting the trigeminal nerve. So that can be something like a tumor, it can be something like an infection, it can be something like inflammation. So, I mean, it's real, but it's not dramatic, where one side is completely normal and the other side is very abnormal. One's kind of at a 90 and the other's at a 75, 60, somewhere in there. So that's the main concern. Is it something like a tumor, infection, inflammation affecting the trigeminal nerve? So the way for us to best find that out is by doing an MRI. Now that's what Dr. DeVita talked with you about. Today is the 3rd.
You're welcome. Yeah, female spayed mixed breed dog. She has a month history of teeth chattering. That's pretty much it. Getting worse. They tried her on Valium. They feel like it's maybe helped a little bit. Recently, she's been slowing down. She's 15. Huh?
Yeah, they do.
They do, and she does it in the room. Yeah. So we talked about seizures versus dental disease. She's got pretty significant tartar and gingivitis, and I can't see any fistulas, abscesses, tumors in there, nothing like that. But yeah, no other facial involvement. So I kind of told him I think maybe seeing a dentist or having a dental cleaning first would be beneficial, but I don't know what your thoughts are.
Yeah, I usually don't think that if it's this sort of stuff.
That's what it is, yeah.
Saw it. I saw it. So Negra's been doing this mouth chattering.
Small children, a lot of them.
Okay. Otherwise, is she eating and drinking okay?
Until this morning, she's showing now, maybe because she damaged the tongue, I think. She's seeing before eating, and it's not the same.
Okay.
But she ate this morning.
Okay. And when did this start? How long ago?
Around 1 month ago. No all the time. And it became worse and worse until this Saturday that we decided to carry her to the veterinarian.
And does it happen all day long, or?
Almost all the day, on Friday and on Saturday. Well, on Saturday, the diazepam released a little.
Like 10%, 20%? How much did it help?
I think not too much, 20% maybe. can't understand how can she made this movement so quickly.
So I mean, it's pretty dramatic. Most of the time when I meet a dog that's having teeth chattering like that, it's usually not a seizure or a brain disorder. So I assume Dr. Perez, sent you over here because of a concern of, is this a brain problem or a seizure problem? Because seizures can cause clenching of the jaws, and dogs can salivate. They can cause repetitive movements. And while I cannot completely rule out that this is a neurological problem, it usually isn't. It's usually either something, with the mouth, or something with, the teeth, or occasionally, we'll get dogs that are just have a stomach upset, that will do weird stuff like this. So we've got two main directions that we can approach this. Approach number one is that we kind of look everywhere other than her brain for this. So we meet with a dentist, and we get a good look in her mouth, and we try and avoid any sort of neurological testing first. The second way we can approach this is to do an MRI or look at it from a neurological standpoint, and hope that I'm right, that it's not a neurological problem and everything would be normal. So there are two main directions we can go. Look everywhere else first, or look at this from an MRI standpoint, or from a neurological standpoint with an MRI. Yeah.
Thank you, doctor. Very nice of you.
Alright. Papi, 6-year-old male intact Yorkie Schnauzer mix. Sunday, woke up alert, taken outside to go to the bathroom. He vomited a while, so they put him in the car to take him to Hollywood. Vomited again when they got to Hollywood. They did an exam, relatively normal, so they treated him for GI meds. When they got him home, he became off balance, so they took him back to Hollywood. They did x-rays, they did blood work. From what I understand, that was within normal limits. Addison testing is still pending. They sent him home. Monday he had another episode. She does have a video in the room. The dog seems like he's like scurrying, bunny hopping, kind of like frantically moving. Works himself up, gets really hot, and then it ends. Took him to Brickell Bay this morning, which is the primary. Started treating him for like GI again. They redid the blood work, was normal, PLI was normal, sub-Q fluid, Serenia, sucralfate. Apparently he had another episode while at Brickell Bay, so they referred him here. No circling, no blindness, no corners, no head tilt. Never a history of having something like this before.
Videos to show you guys.
Oh my goodness, you are tough. I bet no one can get into your house. No one gets into your house.
So this is by holding him. So he would be shaking, like he's shaking nonstop, and you could see his. Like he's in like panic mode here, and he doesn't want to move. We noticed that up here he gets really, really, really hot. And then when I came back from the vet, they told me that sometimes they like overstimulate their nerve or something when they're gonna throw up, because he threw up again in the car. And he's freaking out down there. Like, I don't know, you can't really see it too well. Like
Okay,
he
yep.
wobbles. And then, yeah, I think that stopped. And then this is when he was having it again. I mean, you can't really tell, but like all he does is like, he gets really tense in the front, and he like just keeps shaking. And it just gets really hot at the top. And then once he calms down, like it goes away. But the wobbling, like even though like when he's been walking, it's been.
The videos are helpful in that they kind of, show me those two different times that he kind of lists and fell towards the side. It was very, very brief, but it was very, very useful. I'm honestly not sure what to make of kind of that bunny hopping or almost bucking bronco type of thing that he did there. His neurological exam's normal right now. I mean, he's alert, he knows where his feet are, he's coordinated, he's not acting off balance. Many times dogs, when they're off balance, even if it's very subtle, by me putting his head in, abnormal positions or looking at the way his eyes move, I can kind of make myself feel stronger that it's a balance problem or not. And again, everything's normal on his examination. So, for many of the things that we see, we usually don't see vomiting and diarrhea as part of it. So I guess there are a couple different scenarios. One is just that they're completely unrelated. So, he's got vomiting, he's got diarrhea, and that's unrelated to whatever his problem is. More likely is that they are related. Things like Dr. Gaviria is testing for things like, Addison's disease. That's something that we classically see in small breed. I mean, we see it in Yorkies frequently.
What is that exactly? I'm sorry, 'cause I'm
So Addison's disease is when your body doesn't make enough stress hormones. So when you're stressed out, your body should secrete cortisol, which helps cope with those sorts of stresses. And Addison's disease is when your body, those glands in the belly, adrenal glands, aren't able to release cortisol or enough cortisol.
I mean, that seems somewhat consistent with the fact that he overheats so much when he gets agitated or stressed.
So
or not.
the things that we often see, it's in kind of adult dogs, small dogs, dogs that when they get stressed out they can't cope with it. But many times vomiting and diarrhea are part of the equation. Things like the video where we're kind of off balance and miss a step, those are things that suggest a balance problem, which would say, okay, we MRI the brain. He's small enough that we'd see the brain in the beginning of the neck, probably 60% of the neck, all on one MRI anyway. So we're able to do an MRI. What's the rationale for an MRI? To kind of go from, I'm pretty darn sure that it's not a neurological problem, to I'm 100% sure that it's not a physical problem in the brain or spinal cord of the neck, such as meningitis, tumor infection, etc. So the advantages are, being sure, because if it is one of those, the sooner we can find it, the better. And if it's not, we kind of take a deep breath and, are happy that we didn't find a physical problem in the brain or spinal cord of the neck. So option one, as we'll call it, is that we do an MRI to look at the brain and the spinal cord of the neck to be 100% sure. The downsides are, right now his exam's normal, so I'm not sure, one, is this even a neurological problem? Are we doing the right test? Two, even if we're doing the right test, are we aiming the test at the right part of his body? So the second option is that we hold off on doing an MRI. Not saying we won't do an MRI, but we hold off on it and we wait on the Addison's testing. We continue to give him some, the stomach medications, trying to get the vomiting and diarrhea, or the diarrhea, under control. And quite frankly, hope that we either, get an answer with those, or this kind of just magically goes away. The diarrhea goes away, the vomiting goes away, and he starts acting more like himself. So that's option two, is that we hold off on an MRI. All right, I'll call Dr. Gaviria and I'll let her know what the thought process is and the plan is. All right. All right. Nice meeting you.
Pleasure.
All right. Nice meeting you. Okay. truth of the matter is the only way to be 100% sure that it's a tumor is to biopsy it, but the MRI appearance is most consistent with a tumor. So what we are looking at here on the picture on the left is an MRI kind of with him in profile. So his nose would come out like this. This is his forehead. This is the top of his head. This is his tongue here. So it's like if we kind of were able to unzip him right down the middle. And what this picture is here is if we think of him as a loaf of bread and we make slices. This type of scan, fluid is bright, but on this type of scan, fluid is dark, but we give contrast, so abnormalities like tumors just stand out more. So this picture is made right where this green line is, and this is his right side and his left side. And kind of the first thing you can see is those muscles that are nice and thick on the right are kind of atrophied on the left. And as we scroll back, the trigeminal nerve kind of lives at the bottom of the brain here. If we compare the nerve on the left side compared to the right, you can see it's bigger and it's brighter compared to the right hand side. And it goes all the way back to where it begins in the brain, and we can't really follow it out past that. Sometimes you can see a nerve sheath tumor that goes on beyond there. So what we can say is the nerve on the left is enlarged, it's thickened, it's contrast enhancing. It's consistent with a tumor, but the only way for anything, whether we're talking about nerves or brains or spinal cords or skin or bone, to 100% say that it's cancerous or a tumor is to biopsy it, which just isn't easy to do here. It's kind of at the, I don't think that we'd be able to get there safely. So what are our options from here? Option number one, my recommendation is we say, well, hey, 95% of the time when we see something that looks like this, it's a tumor, and the only treatment option that we have really is radiation. So option one is that we meet with a radiation oncologist, and they would be able to aim radiation beams at the abnormality there to try and shrink and slow the growth of the presumed tumor. So that's option one. Quite frankly, that's what I'd be doing if he were my dog. The second option is that we treat with prednisone. Prednisone's a steroid. It non-specifically takes away swelling and inflammation. There's certain types of tumors like lymphoma that actually prednisone is part of the treatment. So that's option two. The main downsides of that are we don't really know what we're treating, and it will be hard for us to be able to monitor and say, is the prednisone helping or not?
Right.
For what it's worth, it may actually even make things look worse, because one of the side effects of prednisone, in addition to drinking, peeing, panting, and increased appetite, is it can make the muscles atrophy. We call it pred head. Many times dogs that we're giving prednisone for other things, their head the muscles will actually shrink on their head. So it may actually be hard for us to say, well, gosh, is it doing anything here? And will actually be harder to say, are we getting any positive effect? Because just as a side effect, the muscles shrink when we give dogs prednisone.
How fast do you think progression?
Impossible to know. I have dogs that progress relatively quickly. I have dogs that progress very, very slowly. It all depends on if it's a tumor and what type of tumor it is, but then it also depends on where along the nerve it's growing. If, for example, if from here it just continues to grow out towards the muscles, the atrophy will get worse, but it's when it grows sort of in that we see more things like the weakness on the side of the body or behavior changes or things like that. So it really depends.
I'm sure we'll take 1 or 2 days, to look at it and make decisions, but right now, and I think the previous doctor also said that we may not see drastic changes from one day to the other, so that would have been my question, if are these the type of tumors that if we don't do nothing, do they progress rapidly or not?
I don't think this is gonna progress rapidly. I mean, meaning I don't think all of a sudden, you know, there's gonna be a behavior change, or all of a sudden he's going to be weak in one side. The atrophy of the head will get worse over time, but I don't think it's gonna be something that, like, you know, overnight there's gonna be a dramatic change.
And as long as the other side stays healthy, he should have control of his jaw, mostly?
Yeah, I don't expect there to be anything with regards to he can't open his mouth or can't close his mouth or can't chew or can't swallow or anything like that. I don't expect that stuff. It'll be, the most likely thing is just cosmetic. It's going to get more dramatic. That's the thing that I'm, you know, confident will happen. You know, the other things are more serious. The things like the ulcers, you know, weakness on one side of the body, behavior changes, stuff like that. But those are less likely and further down the road. Alrighty, call us if you have any questions. Otherwise, we'll be calling you tomorrow.
Thank you very much.
You got it. You got it.
Thanks for watching. Hope you enjoyed it. Hope you learned something. Hope you found something of value. If you did, feel free to give us a comment, give us a like, share it with someone that you think might get something out of it.